EVMS was cultivated to improve the quality of care in Hampton Roads, to attract top-notch doctors to our region. More than 40 years later, we are still fulfilling that important function. In the 1960s, Hampton Roads had only 86 physicians per 100,000 residents. Today, we have 331 doctors for every 100,000 residents. In addition to their duties as educators and scientists, our physicians care for more than 1,500 people every day at 41 clinical sites around the region. Providers of primary care and highly specialized medicine, they routinely are recognized as leaders in their field. In fact, Hampton Roads Magazine surveyed local physicians and celebrated the top docs for 2012. More than half were EVMS full-time faculty, community faculty, or alumni. More than 1,900 EVMS alumni practice right here in Hampton Roads. More than 2,900 EVMS alumni practice across the Commonwealth. Our alumni and our EVMS physicians make a profound difference for those living in Hampton Roads. Listen as one of our community members tells you just how much EVMS and his doctor have impacted his life.
When I found out that I had colon cancer, it was definitely devastating to me. My daughter was shocked. She even asked Dr. Filiberti, said, well, can you fix him? It was hurtful to me to see my daughter sitting there. I'm sitting there, I'm staying strong, but I really wanted to cry too. The insurance company was saying like, well, Mr. Simpson need to think about, going on disability. And he spoke up and said, no, Mr. Simpson is going back to work. He never gave me any kind of look that it was the end of the world. He always told me, said, you're gonna make it. He would always ask me about my daughter, always ask me how was it going at work. He wasn't just concerned about my illness, he was concerned about my whole life and what went on around me. I had the surgery. When he came out the operating room, he told my family that, said, well, we got it all. When I found out, I broke down and started crying. To me, he was a savior. It'll wake you up, make you see what life's all about, make you turn around and say, hey, stop taking these little things for granted that you've been going through in life. I'm up, I'm walking, and I'm getting better.
Many of you know the first in vitro baby in the United States was conceived at the EVMS Jones Institute. But did you also know that we offer the only high-risk pregnancy and medical practice within an 80-mile radius? We have a remarkable team of OB/GYN physicians led by Dr. Alfred Abahamid. Here's something else you might not know. The Level 1 Trauma Center at Centera Norfolk General Hospital, one of only 5 such centers in the state and the only one in the region, is staffed 24 hours a day, 365 days a year by EVMS surgeons. Dr. L.D. Britt serves as chair of the Department of Surgery. Under his leadership and that of Trauma Division Chief Dr. Leonard J. Wyrider, our surgeons handle cases from Williamsburg to the Outer Banks, provide trauma care for the Navy, and take all pediatric trauma cases. Virginia lies in the diabetes belt, a region of the United States where the prevalence of the disease is higher than elsewhere in the country. About 8% of Virginians have diabetes. That rate rockets to 20% in southeastern Virginia, and this is expected to increase. In fact, our region has the highest mortality rate for diabetes in Virginia, nearly twice the state average. Dr. Jerry Nadler leads a team of world-renowned clinicians and researchers at the EVMS Strelitz Diabetes Center in fighting the disease here in Hampton Roads. They handle about 16,000 patient visits a year. EVMS faculty use an Obesity Healthcare Foundation grant to perform blood sugar screenings in Western Tidewater and an Anthem Blue Cross Blue Shield Foundation grant to perform screenings and provide diabetes education throughout the region. This helps identify people with prediabetes, giving them a chance to seek treatment early and minimize complications. These clinicians also are researchers looking for treatments to better manage or perhaps even eradicate the disease. Some of you may be familiar with type 1 diabetes. It can occur at any age, but often starts in childhood. EVMS physicians and scientists have joined an international effort to test the theory that a virus triggers the disease. Dr. Nadler has teamed with Dr. Julius Nawaldi in our cancer research program to engage unique proteomics expertise in this venture. If the researchers find that a virus is responsible, this research could lead to the development of a vaccine. That could save 30,000 people in the U.S. from getting this devastating disease every year. If you have type 1 diabetes or know someone who does, this is exciting stuff. Our focus at EVMS is translational research. Research that moves scientific advances from the laboratory bench to the patient bedside as quickly and safely as possible. And we focus our efforts around Hampton Roads' most pressing health needs. We recently dedicated a floor of our new building to cancer research. The Leroy T. Knowles Jr. Cancer Research Center was made possible through a generous $1 million gift from the Beasley Foundation.